I'm Dr. Philip Yu, a PhD in stem cell biology. Today I'm going to teach you how to mix and inject a dose of IGF1-LR3, that stands for insulin-like growth factor, long arginine 3 peptide. It basically has three effects. It causes cell division, so more connective tissue, more muscle and bone growth. Number two, it promotes fat burning by lowering your blood sugar, basically causes your adipose tissue and your liver to release more glycogen and triglycerides to burn fat calories. And three, it's a myostatin inhibitor. Basically, myostatin is the enzyme that prevents muscle growth. It's a governor, a limit to amount of muscle you can grow. So it shuts that down, so it frees up your limitations in muscle growth. So without further ado, as always, you're going to get your bacterial static water. Once you open it, you're going to take an alcohol prep pad. You're going to disinfect the top where you put the needle in, and you're going to pop open the IGF1-LR3 peptide. This is a 1 milligram vial, so I'm going to dilute it into 10 doses of 0.1 milligrams. So that means I take my 30 gauge 100 unit insulin pen. And although I just pop this, I don't have to, just for habit's sake, I'm going to disinfect that. I take some air out of the insulin pen to make back pressure. I push the bottle towards the needle so the needle doesn't break. Push in the air to make some back pressure, then draw out 1 cc. I go over the mark of 100 units, 1 cc. That way I could push out the air bubbles. Okay, so I'm going to just push it to 100. All right. I take the peptide vial and I put the backwater in on an angle, because if you just plunge it in too fast, it could break the peptide bonds, because the peptide bonds, they're very fragile, and you're going to ruin the potency. So I just let gravity push it in real slowly so it hits the side of the bottle, so it kind of drizzles in. And so it gently dissolves the lyophilized peptide, the powder. And so I'll just kind of gently roll it around like this until it's homogeneously dissolved. So I like to look at the bottom of the bottle. You can see the powder is not dissolved, so I'll kind of just roll and gently dissolve it. Just one little clump right here, and then we're ready to go. Okay, it's dissolved. You can see it's homogeneous. So we take the same insulin pen. Again, you're going to push the bottle towards the needle so you don't break the needle, like that. And then you're going to draw out again past 100. And that way you could just push the liquid up. And so it's just a 10 unit dose. So what you do is which is 0.1 milligram. You inject it in, just pinch your belly fat and go perpendicular, inject it right in, and done. I like to do it before bedtime just to get that growth hormone release, more pulses at night. And you can do it after you weight train, all right? Just to take advantage of the growth hormone release after training, okay? So I'll do that 5 days on, 2 days off, because you don't want to build a tolerance. And I'll go like, 8 to 12 weeks on, 4 weeks off, okay? So that's how you mix and inject and dose IGF1-LR3 growth hormone releasing peptide. Thanks for watching.